Hello.
Hello. Looks like I'm turned around here. Hold on one second.
Happy Valentine's Day.
Thank you. Happy Valentine's Day. Sorry, I thought I had everything set up nicely, but I guess not. Hold on one second. Okay. Hold on one second. Let me just back my camera a little bit here. Maybe we'll be in a better place. Nope, still not. Almost.
There we go.
There we go.
There you.
I was trying to be a little bit taller.
The internet world on social media, it's really hard to tell people.
I know, yeah. I had set up everything earlier today, and I was like, all right, I got it all set up, and we still got a little bit rough start there.
Okay. All right, here we are. So happy Valentine's Day. Thank you, Dee, for joining.
Of course.
Is the second installment of our IG Live series that we're doing this month, featuring Black women in health, medicine, and wellness. And Dr. Deidra Morrison is my dear colleague. She is a pelvic floor physical therapist as well. And I'm very excited to have her here to chat. So when I think of Valentine's Day, I don't know about everyone else, but I think about love and intimacy and baby making. So I thought it was perfect to have a physical therapist here to chat about some of those important topics and how pelvic PT can help.
Yeah, absolutely. So yes, I like you think of those things as well. And as a pelvic floor physical therapist, I always explain to my patients, nothing is off the table here. Everything that I do as a pelvic floor therapist is related to bowel function, urinary function, and of course, sexual function. So, and how that pertains with the pelvic floor is thinking about things like painful sex, for instance. And I always like to encourage my patients to understand, or people in general to understand, that painful sex is not normal. And it is, however, unfortunately, very common, but very abnormal, and something that you can work on with a pelvic floor physical therapist to improve what could be causing those problems. And so some of those problems could come from some hormonal changes, but it could also come from muscles that are too tight or too restricted in the pelvic floor. And so as a pelvic floor physical therapist, we come in to assess the patient and see where those impairments are and improve the tissue extensibility, or help the tissues to soften so that they can contract and relax normally, and so that they can have enjoyable sex. On the other end of the spectrum, some people, after having babies, they may not have pelvic pain, but they are not having the same amount of enjoyment or sensation or feeling of their partner. Yeah, and so that's like on the opposite end. Maybe the pelvic floor needs to be strengthened more so to improve that ability to feel their partner, and so that they can enjoy sex again.
Right. And that's all along the lifespan. So that is something that pelvic floor physical therapy can help with, no matter what age, in regards to painful intercourse, painful sex, and then just pelvic pain in general. So
yeah, I think that's a really important thing to go back to, because a lot of patients that I get, sometimes they're in their 30s, they might even be in their 60s. In Florida, we have a very large geriatric population, of course. So I have the luxury of seeing patients that are very young and those that are a little bit more seasoned. And so what I'm finding is that a lot of people have these problems starting in their teenage years, or maybe even in their 20s. And I have had several patients that say they've never had comfortable sex. Like, it just hurts, And so really try to hone in on the education part of that, so that people understand that it's not normal for it to hurt, and there are things you can do about it to make it more comfortable.
Absolutely. So you and I actually met at a pelvic floor physical therapy course.
Yeah.
It was before COVID, so it was a while ago now.
Yeah, it was. It was a while ago. It was back in 2019.
Mm-hmm.
Yeah, in November. Yeah.
So how did you get into pelvic floor physical therapy?
Yes. So let's see. When I was a student at Howard University in DC,
Yeah.
we did a short module on pelvic floor physical therapy, and
Mm-hmm.
it was automatically very interesting to me. Just being able to impact people with things that are very important to them. I mean, what's more important than having sex? Going to the bathroom, right? These are things that we all do.
Yeah.
And so, it was always an interest. One of my dear friends and I, we had plans to have our own clinic someday that would really cater to the needs of women and women's health issues, including pelvic floor.
Mm-hmm.
And unfortunately, life happens. I ended up here in Florida. She's still in DC. So we weren't able to do that together, but it was always something I wanted to do. And then after I had my two children, I have a 10-year-old son and an 8-year-old daughter. I definitely understood even more why pelvic floor physical therapy was important. So after I had my children, it was something that I had a chance to kind of take the moment to refocus on again. And so here I am.
Wonderful. And
Hmm.
then your business is in Orlando, yeah?
I'm sorry. Say
Your
that
business
again.
is in Orlando?
Yes, I'm here in Orlando, Florida. It's very nice and sunny. It's a little bit chilly here, but I say that very reluctantly because I know you're up in New York and it's probably actually really cold.
It's super cold.
Yeah, but I'm not sure. I think it's around 50 something here, which is cold to us.
Mhm. So, in terms of pelvic floor PT, can we talk a little bit more about postnatal and, how it's honestly really recommended that women after they give birth come to see a
Hmm.
PT at least once just to check in.
Absolutely. Yes. I think that it's one of those things that is not often recommended, but I feel that any woman that has ever had a child whether it's a vaginal birth or a cesarean section, they should definitely see a pelvic floor physical therapist.
Mhm.
There's a lot of changes that happens to the body,
Mhm.
from the anatomy to your hormones. And it's something that as pelvic floor physical therapists, we're really good at evaluating our patients postpartum and finding those things that may be occurring, that could be contributing to pelvic floor dysfunction. And so, one of the things I can think of quickly, again, going back to painful sex, a lot of times after you have a baby, even if you didn't have a tear, even if you had a cesarean section, you can still have those changes just from holding, that baby
Yeah.
in your body for those months. And,
Mhm.
when you get to delivery, the baby was most likely somewhere between 7 and 8 pounds. So your body really does need that TLC after having a baby. And a lot of people don't look at pregnancy this way because we do it all the time. It seems so easy, but it really is a traumatic event on your body. And so definitely would benefit from pelvic floor therapy afterwards.
I know, especially for patients that I see for pelvic floor PT um,
Hmm.
or C-section, up until or once they're past that 12-week mark where we can start scar mobilization and just get into
Hmm.
that. Sometimes that is really a contributing factor to some discomfort or referral of pain into the pelvis and just being able to return to normal activity that they were
Hmm.
maybe in an exercise class and they're wanting to get back to using their core, using their abs more, getting the scar mobilization can help tremendously as well. And
Hmm.
then there's with orthopedic musculoskeletal physical therapy because I know you have your foundation in orthopedic musculoskeletal PT as well. There's so
Hmm.
much that can be done from a ergonomic posture standpoint and just working on how to hold the baby,
Hmm.
mechanics for bending over and picking the baby out of the carriage,
Right.
all of these things that aren't considered before, but then afterwards there's definitely some attention that's needed.
Yeah. One of the things I get contacted about a lot is diastasis recti, because people will have that little pooch there and they're trying to get back into their sexy clothes, or maybe they just don't want to have the pooch there. And I
Yeah.
think it's interesting that they don't, and why would you consider the leakage to be a
Mm-hmm.
part of the diastasis too? And so that's another big thing that we work on too, is working on improving that lower abdominal strength so that then your pelvic floor can function properly as well. But I think an important thing that we should point out, so a lot of people, when they hear pelvic floor, they think, oh, I can just do Kegels and everything is going to be better. And that's not true. You definitely, even if you see your OB first and then go to pelvic floor therapy, you definitely want to have a real comprehensive evaluation to look at your anatomy and make sure that everything is functioning properly before
Mm-hmm.
you get into those Kegels, because it can just make their symptoms worse.
Absolutely. So
Mm-hmm.
for the Prosthesis Recti, I've done lectures and workshops on that. And
Mm-hmm.
for anyone who's listening who doesn't know what that is, Dee mentioned the pooch, so that's something visual that you can see, or that little bulge. But what's actually happening in diastasis recti is the six-pack muscle, your rectus abdominis,
Mm-hmm.
separates. So there is naturally a separation if you are carrying a baby, but what happens in the diastasis is that it will stay separated. And so there's ways that physical therapists can measure and see how much of a separation is there. And what Dee was just touching on is that making sure that your core is healthy, functioning properly is super important for your overall spine health, pelvic floor health, because all of these muscles are working in unison to maintain intra-abdominal pressure and just keep your body stable and supported. So that's one thing. And then the other thing that you just said, what were you just saying? You were saying,
Um, oh, I was just saying, just the connection between urinary leakage or stress incontinence, um, that relation to the diastasis recti as well.
yes,
Hmm.
yes.
Yeah.
So
So,
if the core, because the transverse abdominis is the deep core, pelvic floor is part of the core. If those muscles aren't firing properly, you could potentially have
hmm,
saying urinary
yes.
leakage, which pelvic floor PT can also help with.
Hmm. Definitely. We're really good at it. Yeah. And I think going back to what you were saying about postpartum and working on body mechanics, breathing patterns,
Mm-hmm.
those are all important things for sure, especially after you have a baby. Positioning with breastfeeding as well, those are things that we're good at just as physical therapists. But then we get the extra bit of expertise because we are good with the pelvic floor too.
Yes, yes. So urinary leakage we just touched on. So let's talk about, so before I started my business and I was working on Long Island at a women's health event, and there was actually a resident physician who came in who was working in a local hospital at the OBGYN. She was studying to become an OBGYN,
Hmm.
and she presented some statistics that were kind of shocking to me at the time and saddening for sure, that there was quite a discrepancy in
Hmm.
the resources available for women in labor and delivery, and that there actually were and still are higher mortality rates in the areas
Mm.
resources, lower income. Um, and I know for you, that was something that we spoke about not too long ago, and it was like,
Hmm. Yeah, I think I became aware of that statistic. I want to say like it wasn't that long ago, honestly, like in 2018, which I guess that was a long time ago. But yeah, African American women are 3 to 4 times more likely to die while pregnant or while giving birth, or even I think it's like even a year after giving birth. And I think when I heard about it first, it was actually regarding Serena Williams. And when she, I think it was the day after she had her daughter, she was experiencing shortness of breath. And she went back to the hospital and she told them that she was having shortness of breath and that the physician just sent her away and was just like, you're fine, whatever, whatever. And then she grabbed a nurse and actually diagnosed herself and asked for a CT scan and a blood thinner drip. And, you know, given her history, I remember when she had a pulmonary embolism or blood clots in her lungs after an orthopedic surgery. I think she was on like a flight or something. So, you know, that just goes to show this is a very wealthy, well-known person. And she was expressing, you know, healthcare concerns. And she basically, if she wasn't an advocate for herself, then she could have died very easily. They still didn't do the CT scan. They ended up doing the Doppler, which is an ultrasound for the legs. And they saw that, you know, that was abnormal. And then they did the CT and then she went into surgery. But that should have been the first thing that they should have been looking at, given her medical history. So, yeah, that is something that is just, you know, very unfortunate. And I think the best way is to be aware of that, you know, for ourselves as African American women, so that we can be more advocates for ourselves. And then as well as the healthcare community too, and just, you know, really looking at people with open eyes and looking at each other, you know, as you would a relative, and really taking that invested interest in what you're doing and making sure that you're really taking care of them. I think another disparity would be uterine fibroids is very common in the African American community too for women. I think it's like a quarter of African American women have fibroids between the ages of 18 and 30. And then once you get to, yeah, it is a lot. Compared to Caucasian women, I think it's only like 6%. And then after the age of 30, that number hikes up to 60%. And again, yeah, there's a lot of different beliefs as to what is causing that. Some of it is diet. I believe some of it is stress related, genetics too. And then the other one is hair relaxers and the chemicals that are in relaxers to straighten the hair, which a lot of African American women use. Not as much now, because wearing your hair is natural is more of a thing now. But I guess the chemicals in that can reduce, can produce certain hormones that can then lead to the fibroids. So it's a lot of speculation on what is really driving that force. And so Black women are also more likely to have surgery from those fibroids, and have more complications with it too. Yeah. And then the other one is breast cancer. Black women are more likely to die from breast cancer than women of other ethnic backgrounds. So there's a lot of healthcare disparities amongst Black women. And again, I think it's just really important for us to be advocate for ourselves, but then as a healthcare provider, making sure that we are giving that care and attention to everybody and an equal amount of time and consideration.
Absolutely. What would you say your vision for the future is for, you know, helping with these disparities?
Yeah, I think a large part of it is just having more people in the profession that look like myself. Now, I went to Howard University, so it's a predominantly Black school, so everybody looks like me there. But when I go to courses and when I work in the clinics, you know, I'm often the only one. And a lot of my friends from PT school, it's the same. And so I know years ago, I think just African Americans in general made up, I think, 2 or 3% of the population of physical therapists. And so that's a really small amount. Yeah. So my vision would be to, you know, to see more women and men of color, specifically African American, to go to physical therapy school or even become nurses and doctors as well, because sometimes when you see a person that looks like you're a little bit more likely to open up and discuss some of the things that may be going on that maybe you won't be as comfortable with sharing.
It sounds like a great vision, and I can see it happening, you know?
Mm-hmm. Yeah, for sure.
Well, Dr. D, thanks so much for sharing your time. It's been really lovely to see you and to chat with you about
Absolutely.
pelvic floor PT and then some other
Mm-hmm.
important topics that we want to spread the word about so people are informed.
Mm-hmm.
Anything else you wanted to say? Any final remarks?
No, not really. Just happy Valentine's Day. And if you're having any pelvic floor symptoms like painful sex or less enjoyable sex after having a baby, even if it isn't painful, make sure that you reach out to a pelvic floor physical therapist. We are very capable of helping you, and especially if you're here in Orlando, Florida.
Yes, yes. And if you're in Brooklyn, be sure to come to Inspira Physical Therapy. We're right on
Yeah.
Fifth Avenue in Park Slope between Union and President Street. So, Dee, thanks so much. So everyone who's been tuning in, we have another wonderful guest next Monday, the 21st at 7:30 p.m. Eastern Standard Time. Dr. Peggy Robinson is going to be joining us. She's an acupuncturist and owner of Cornerstone Healing in Carroll Gardens, Brooklyn. So she's a New York City local. And we'll be continuing the conversation then. So Dee, thanks so much again. Happy Valentine's Day.
Thank
And
you. Happy Valentine's Day.
yes, and we'll be in touch soon, okay?
Absolutely. Take care.
Bye.
Bye.